Have you ever seen, it is only when I ask my students, have you ever seen an animal with a bleeding nose? Oh, then they start thinking, oh Allah. Why? Because this translational medicine and looking at cross section of the it's called the human zoo, cross section of the kingdom, we don't study like that. We only look at humans and humans. You have to look at also sideways. You will never find an animal with a stroke. You will never find an animal with a bleeding nose. Why? Because animals synthesize ascorbate at the rate of 1000 to 2000 milligrams, and it vastly amplifies when there is stress. Please know that ascorbate or vitamin C very powerfully induces an antiviral drug which the body synthesizes. We can't do that. So the other lady who had a meningitis terminal, she is fully comatose. They said tonight she will die. After all, so when a young mother, and tonight she will die. Anyway, so viral meningitis, so sad. Then I said, anyhow, you told her, DNR, do not restate because she is dead, because she is fully comatose. And I pushed in those days, now I feel it is not available. I pushed in 6000 milligrams of vitamin C. But that is in the afternoon. By late evening, she gained consciousness. By late night, she became alert. By next morning, she fully recovered and walked out. What a miracle it is. Is that part of our current treatment? No, we don't. That will not come into medicine. Now, I told that to my neurologist, sir, animals don't have a stroke because they synthesize ascorbate. The moment I told, immediately he started putting on every patient on ascorbate. Then who will do the comparative study? The nurses will. And then, sir, E neurologist, no patient of his has a second stroke. The other neurologists, many of them are having a second stroke and they die. My father-in-law had a stroke. After a short while, that knowledge was not there. Short while he had a second stroke. If a second stroke, many of them will die. So, either you have one vitamin C fresh lime juice every day, that will give you 50 milligrams, or one vitamin C tablet. What do I advocate? By Glaxo is a good company, and Selin is the one which is available. If you take bleeding, hemorrhagic stroke, 100% will not happen. Is that part of medical training and teaching? No, it's not part of that. But that is the issue. Do we ever teach that? Will you ever know these things? You will never know. But in the absence, you look at yourself. Earlier, or even only in 5-star major luncheon or dinners, after dinner or lunch, then we'll have a lot of fruits and some ascorbate will go in. Today, is there any fruits in your diet? It's not there. 50 milligrams because the humans are defective machinery. We said earlier there was a movie called Mutant Ninja, Teenage Mutant Ninja Turtles or Mutants. Movies about we are mutants, in which our one genetic gene of synthesizing gluconolactone is locked, and therefore we can't synthesize ascorbate. You have to have ascorbate in your diet. Now, because we are in that area, how many female ladies especially, we come across terrible varicose veins and swollen veins, and once it becomes an ulcer, life is miserable and hell. Why? Because veins contain a valve. When the valve is defective, the blood will engorge and varicosity will happen, and ultimately an ulcer will happen. Then life is a living hell. What is it that makes the valve strong? Is a drug or is an ingredient called procyanoanthidine. Where is procyanoanthidine present? It's only present in the skin of fresh lime. So, if you are drinking a glass of lime every day, that lime skin you put in a bottle of water, put some salt in it, maybe a little bit of turmeric. In about a week's time, it will become like a pickle. It will be very, otherwise it is hard. But in a week's time, the lime skin will become very soft. Once a day, please take a lime skin. Once a day, half a lime skin, it's all in that bottle. Take it. 100% I guarantee you will not develop varicose veins. If you have varicose veins, the whole thing will shrink. And when one lady, terrible swollen, what is the only option? Surgery. They will put a wire into your vein and strip it out. It's called vein stripping. But in this, she was so frightened about that, and the weight was swollen. She ate one entire lime skin every day. By about 3 weeks, the entire thing disappeared. Now, where else is the valve weak? It is in piles. How many people are suffering from piles, and then you have to undergo surgery, and the surgery is miserable and all that. But if you take this, 100% this vein valve weakness will not happen. Even if you have piles, grade 2, grade 3 is projecting out, gradually it will shrink and disappear. Of course, what I am saying is counterproductive to the business of medicine, because once you cure all that, how will pile surgeons survive? Or how will eye doctors get some cases? You will have no cataracts, your vision will be perfect, there will be no piles at all, there will be no heart problems. But come back again to the stroke. I said one is hemorrhagic stroke. When there is a bleeding in the brain is neutral, it can only feed on a fluid called cerebrospinal fluid. Blood is highly toxic. A little amount of blood touches the brain will die. So, look at a tire. Sometimes I look at the tires of the flight when it's landing, it should be so good. Similarly, the vessels should be so good. Little amount of pressure increase, then the vessel will give way and blood will seep into the brain and you will have a stroke. Whereas, if you were to take an ascorbate 1 glass every day, 100% hemorrhagic bleeding will not happen. But is there any other type of stroke? Yes. If you have BP, blood pressure, if you have, then it causes a condition in vessels called lipohyalinosis. All that is my new knowledge, I never knew. Long-term blood pressure will cause lipohyalinosis, in which the blood vessel will become thin, smaller. At one point, the blood will not flow, and ultimately at some point the blood flow will stop, and then the brain will not get nutrition and the brain will have a stroke. When does that happen? I had blood pressure for 20 years. So many things I tried to bring it down. Naturally, being in medicine, so many things of knowledge is emerging. Do you know there's one exercise that brings down blood pressure? And that they discovered when pilots were being trained for astronauts, long distance pilots, one exercise they did brought the pressure down. What is that? If you were to hold your hand, intensely contract for 9 seconds and leave it, then the body relaxes a bit and brings the pressure down. But who will commercially take advantage of it? One company did. No, how much you contract you will not know. So therefore, we will bring out a machine that will tell you exactly how much to contract. And so therefore, I saw the machine. If you contract it exactly when it is the proper pressure, it will issue a beep saying that you have got the proper contraction. Hold it for 9 seconds and leave it. Now, one lady in our house, in our flat, suddenly her blood pressure shot up. I sent her to a good cardiologist. He kept on increasing drugs, it's not coming down. At some point, the pressure is so high, the blood vessel will burst. Then they will have strokes, many of them will die. So, having known this, her son being in America, I said, you better get that machine, because ultimately, because we are in the same flat, no, you better get that machine called Zona Plus. And she got the machine, and then she came and I showed her how to do it, and consistently if you do, the blood pressure was remaining low. But normal husband, wife and everything, how come suddenly shooting up blood pressure? Then I discovered both children, both are MBAs, one was saying, and the son fell in love with a girl in his office who was of a different, blood group, I must say. And he was this, she was that, and they decided to get married. After that marriage, after all, he has found his life mate. No, why are you bothered? Anyhow, when that happened, the blood pressure shot up. And then she was doing this thing and it was being maintained. Ultimately, like most couples, they started fighting and ultimately they got divorced and separated. Once that separation happened, the blood pressure also came down. Anyhow, these are various stories that I have come across. So concerning that, as a doctor, I should know. 20 years I took a BP medicine, it was not coming down. Why was it not? I had a suspicion that maybe there was a block in my kidney vessel. Professor Ullal, cardiothoracic, he used to teach us, when there is a block in the kidney, it's a critical organ. In order to overcome it, the body will increase the pressure to overcome, because the kidney cannot be compromised. So then I'm thinking maybe if I'll do a scan and find out. But then if there was a block, what can anybody do? Can anybody put in a thing and like a heart they can put in a balloon and bite it? But kidney, I have no idea. Even though everything I know, I have no idea whether anybody will do it in Mangalore. But sometimes I have to talk a little politically incorrect, sir, because one thing happened is I was spending my life, of course, in Kannur with my parents, and gradually there were 3 flats and all that, and I was running a nursing home too. But in his wisdom, the house where we were staying with my parents and 3 flats were built. Much of it was my money. Ground floor was my father's money. I thought 3 flats meant I have 2 younger sisters. For each one flat, no. But ultimately, when he passed away, he has written the house in my second sister's name. And the moment he said my mother can stay as long as she is there. The moment my mother passed away, with a battalion of police in the middle of my practice, 100 patients were waiting, they brought the police and pushed me out of my house. The hospital which I was running was written in my first sister's name, all multimillionaires. Still, they came from America and they locked the hospital and left. My God, that is too much of a stress that I could take, and my BP shot up beyond control, and then I had a stroke. 3.5 months I was bedridden. But then in that journey, being a doctor, I said I will look at, no, I can't then, because my sugar shot up. 3 times I was on insulin, and 20 years I took a BP tablet. But I was grotesquely obese. So many things. I joined the Talwarkar gym. I used to go to Kadri Park. I used to do nothing will happen. Please know, all this science is bogus. We wear a Fitbit watch saying that you must walk 15,000 feet a day. All rubbish. They said 15,000 just to sell their watch. Rubbish. I looked at the best center in the world called the Salk Institute. Director Dr. Panda. He said only thing in my bedridden days I was semi-conscious and like that. Of course, Paul was there every day to help me out, and he said, just look outside. Or by evening, afternoon, all the birds are going back home. If you look at the roads, all the sheep, goat, cow, after morning feeding, they are all going back home. Have you ever found an animal who is obese? That is the way. They have come with knowledge. You humans are absolute zero knowledge you have. So he said, that is the way. It is not the exercise or diet. No, look at that way. Afternoon onwards, whatever you eat becomes fat. What happens? It fills the kidney and closes it, causing hypertension. It fills the brain and then causes what is called a stroke. It fills the liver and causes fatty liver. How many people are suffering from fatty liver? If I do a scan of all of you, many of you will have a fatty liver. It fills the gallbladder and then causes gallstones. So fat is the culprit. And do you see that in animals who are living a natural, normal life? So follow them, I said. So it is not immediate. So what I did was I had my last food at about 7, 6, 5, 4, 3, 2, and then I cut off at 1 o'clock. Now if I do that, the next 10 hours my energy comes from glycogen, which is stored in the liver, which means at 1 o'clock if I cut off, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. By midnight, my glycogen store is over. Where the energy will come after that? It has to come from fat, which is an energy store, no? So the fat starts getting burnt off. What is the indication? The urine will have high ketones. Which is it so? Midnight I asked the nurses, please check my ketones. It was highly positive. From midnight my ketone, which means my body was burning off fat. And I used to minutely follow my weight. Gradually 200 grams a day, it is coming down. And from 110 kilos, I'll share these photos with sir, then you can share with them. All the fat burnt off, and finally when I touched about 69 kilos, from 110 we cut to 69, my weight disappeared, sugar disappeared, BP disappeared, now nothing is there. My endocrinologist said, sir, he was very strict. He said, sir, let me be very clear, you have to take insulin for the rest of your life. My mother took it for 20 years, and because after 10 years complications will happen. In spite of treatment or no treatment, after 10 years of diabetes, complications will happen. My uncle had his leg chopped off. My mother was almost blind. And another person had an excruciating, unbearable pain, diabetic neuropathy. So I said, no, I can't suffer all that. Dr. Panda, he said, you can reverse your diabetes. That's the first time I knew diabetes can be reversed. So having strictly followed what the other day a group of, sometimes we have student discussion, but sometimes we just throw up a topic, what is happiness? They each had its own concept of happiness. Ultimately, when it came to me, my greatest happiness was when the endocrinologist came to my room and said, sir, I am signing off from your case sheet because I have nothing to offer. You have no sugar, no diabetes, nothing is there. And the nurses tell me, you are the first person to come out of the hospital without any sugar, tablet, insulin, nothing is there. You see, diabetes, please know very clearly, is a 100% curable condition. High blood pressure is a 100% curable condition. There are other aligned factors for blood. I said, one is the exercise, that is say. Second is, sunlight causes vessels to dilate. Why? Because it causes release of a nitric oxide, which is why people who work in bright, manual laborers, they say, no, we are protected by God. No God. Sun protects you from blood pressure. Please realize that. And when we looked at blood in high BP, we found salt to be high. So he said, oh, high BP, you uppu muttubaru, salt restricted diet. No, the body will try to maintain itself. So when something is low, it pushes up the salt, sodium, to maintain what is called homeostasis. What is low? That is calcium. Framingham heart study, multiple risk factor intervention trial, the GCS trial found those who are drinking less than a glass of milk a day will have high blood pressure. So therefore, at one point I started giving people either a glass of milk, or it is much easier to take a calcium tablet every day. And 9 weeks later, what is the essential area where calcium is required? Bones. If your bones are weak, one fall is enough and your bone will crack. If this does not have solid granite, a slight shake is enough for the building to fall. So similarly, your bones must be absolutely strong. Have you ever tested your bone, or once a year, beyond about 55, I think you must have what is called a bone mineral density. Have we assessed, for those I saying, have you, even for your parents, have you even once looked at your bone mineral density? We said calcium. No, please know, bones contain calcium, magnesium, manganese, tin, nickel, selenium, chromium, molybdenum. All these are required. All these micronutrient minerals are required. Is it part of the health advisory now? No, we don't teach that in medicine. So, didn't you drink every day a nice good mineral juice every day? Yes. I remember every day those days when we used to have rasam, tairi mori rasam sambar, but rasam is a concentrate of all the minerals in the vegetable. Nicely, and then we take rasam, or all the various vegetarian dishes that are there in a thali meal. It contains all that. Where is that today? It's not there. So in the absence of it, in order to maintain bone mineral density, please take I never knew that there was a tablet containing only minerals, and that is Riconia. But it contains the better part, because they added a lot of B-complex to it. That's called Riconia silver. Please take that one tablet at least 10 days of every month. Your bones will be strong. 10 minutes please spend in sunlight. Today I don't even have 1 minute in sunlight, because I have an underground flat park. From there I drive to the no sunlight, drive to the hospital, park there. 1 minute my sunlight exposure is only about a minute. My chairman, our chairman, he said, see, we wanted to start a cancer center, postgraduate course. That is his level of vision. So in order to have a cancer degree, MD in cancer oncology, you must have a cancer hospital. You can't do that in a medical college. So he started a cancer hospital just for that. But he says, I'm surprised at the flood of cancer patients coming in. Why is that so? So many cancer cases in Mangalore. There are 3 or 4 cancer centers in Mangalore. A flood of cancers. Where was it earlier? But then, again, I look back at our days, my 3rd, 4th standard, hardly few minutes we will spend inside a small little, like a hut, not a hut really, our village houses, like a small house. The large part we are playing in the fields. We have to walk a long distance maybe to go to school or whatever. So much of sunlight exposure. And I had been for a journey to China. One trip we went, we were on the top floor and I was looking down at the school, 7 o'clock. So all the students have come in. All the students, teachers, by 7 they are inside and shut the door. Till 9 o'clock. 9 o'clock there was a bell and the entire student, including the teachers, they all came out into the open ground and had a half an hour of good drill. Half an hour, isn't that enough? Absolutely enough. Half an hour of sunlight, where we get? No, you don't get. At that time when he asked me, I said, sir, I don't know why so many cancer cases. But today, please know, a cancer is waiting to happen if your vitamin D level is less than, if I check all of you, you will be around 10 or 20. Sometimes even less than that. Your vitamin D level should be 80. How do you do that? Today, our routine is such, you can't expose yourself to, and beyond a point, 50, 55, even if you sit for 1 hour also, the skin loses the ability to synthesize vitamin D. So, therefore, you must either spend half an hour in sunlight, bright sunlight morning, or take a vitamin D tablet every week. 60,000 units, Devion once a week, 20 tablets a year, and 20 weeks later, if you check your vitamin D and if it is 80, then you are stable. If you are not, you got to continue that till it is 80. If it is 80, there will be so many, even as we speak, small cancers are happening, but the body kills it by what is called TNF. TNF means tumor necrosis factor. That is triggered by vitamin D, it will kill. But if your vitamin D is low, then a small cancer happening, suddenly it will explode. And so many people are dying. So sad it is. So sad it is. So, am I shooting time? If you want me to stop, I can stop. So, then, once in a way, it is good to, I have twins, boys, small children, and so many, children have the maximum amount of curiosity. Appa, what is that? What is this? So, I used to take my children to, please do that. Please go to Bandar area. I hope I am not being recorded because these are politically incorrect things I am about to say. I used to go to Bandar area and you see that thousands of fish are brought. And we see all that, so many fish and all that. At that time, I used to wonder, oh my God, thousands of fish, no cancer. Why is it? Because fish is in a highly alkaline medium. A cancer is a genetic mutant who is like an alien being. Please see that movie called Species or Species. That shows it's an alien being. For a cancer to survive, it requires an acidic medium. Once a cancer starts, for it to breathe, we require oxygen, it requires acidic. So, it will alter the biochemical pathway in such a way that your body will become acidic. So, is it so? Years passed on. Is it so? Oh, maybe. So, shall we do a study? Being a head of department and professor, we can initiate any study which we are supposed to do anyway. So, I said, let us do. So, so I think we spent about 70,000 rupees for a, 7,000 rupees for an annual corporate checkup. 7,000 rupees you pay, and any corporate hospital, they will do all the checkup. What is the essence of your health? Those days, I was, in fact, I have seen that happen. Nowadays, it's not there. But if your battery is acidic, if your car battery is acidic, immediately the terminals corrode and white substances will come. Nowadays, it is, I think, seal batteries. They used to use a hygrometer, tumba acidic agide, then they'll put on alkaline water and make it neutral. Now that era is gone. But if your body is acidic, imagine how your bones are going to be corroding and how a cancer is exploding and so many organs are getting hurt. So, if a cancer is there, it will make your body acidic. Now, are you alkaline or are you acidic? I don't have the paper, in my earlier talk I had. Ordinary litmus paper, which either in a lab you can get from Amazon, small little thing, it costs about 20-30 rupees. One paper, it costs 10 rupees. Take a litmus paper, put it on a saliva and look at it. If it is absolutely purple or blue, you are highly alkaline. Reddish means acidic. Do we do that your pH test in a lab when you go for a health checkup? It is not done. Not done. So, I will not name the name, but sir might know him, a very distinguished prominent person. And naturally, as friends, he came to our hospital. I'll tell in Kannada. Allah sir, just on the mutti nodi, there was a small little lump. But touching, feeling, and understanding and knowing, the sense of touch today is lost. Today, nobody is recording. Today we charge 1.5 to 2 crores one seat. Medicine, gynecology, pediatrics, we charge 2.5 to 3 crores. Radiology is 4 crores. So the moment we get a patient, we don't say touch and feel and palpate. These are part of medicine. Today, the moment they say, adu scan ಮಾಡಿ, MRI scan, CT scan. No. When I touched it, it was a little hard. I can't tell him that. A distinguished gentleman. So I said, we'll just do a test. There is something, they put a needle and test. That's called fine needle aspiration cytology. And when we tested it, just one small poke, it was grade 3 spread cancer. It had spread throughout his body. But it had come from somewhere we didn't know. But he being, he said, I can't suffer anymore. I can't suffer at all. Because chemo, radiotherapy and all that, one is it will cost 25-30 lakhs. Number two, if a person undergoes chemo, radiotherapy, why? You can't even imagine the suffering that they undergo. So I said, I'm not going to take that. I just want to die. Now, what did I say? A cancer cannot survive in an alkali medium. So, he was related to a distinguished doctor in Mangalore. My good, the patient was a good friend. What did he do? He sent him somewhere. Every day he made him drink 2 liters of very powerful alkaline water. I'll tell what it is at the end. 2 liters, 2 bottles of alkaline water you drink. After all, chemo, radiotherapy, and nothing you do, anyhow, drink it. 3 months later, the spread metastatic terminal cancer slowly shrunk and disappeared. Completely disappeared. Now, look at alkaline areas in the world. Where is that? Of course, we fight with each other, but the Hunza Valley in Pakistan, the Hopi Indians in South America, the northern island of Japan called Honshu Island, where the ice is melting and coming, high concentration of calcium. Calcium is the most powerful alkali in the world. Before that is cesium, calcium, high calcium. So, which is why again I come back, if you have daily calcium also, it will protect you because your body is becoming alkaline. These areas in the world now, the American major universities are sending scientists there. Why is in Hunza Valley no cancer? In Hopi Indians no cancer? If your body is highly calculated, have you ever tested once a year at least? Have you tested your salivary pH and looked, are you alkali? You have not done that. Now, what is the 2 liters of high powerful alkali liquid that he drank? Is original farm bred cow's urine. When green grass origin, not the local, we give all sorts of rubbish, but farm bred cow's urine is highly alkaline, which is why so much opinion about this Gomutra thing, it completely disappeared. You see what a magic it is. If you go to an oncology cancer specialist, what is the use of alkali? And they will say, oh no, rubbish. Why? I know it is a wrong thing. Why? Because every time I treat a patient with the cancer chemotherapy, 25-30 lakhs, maybe 2-3 lakhs will come my way also. That's how the world is. That's how the world is. The company that sells acid drugs, proton pump inhibitors, they don't come to me because I don't give acid. How many acid cases or reflux or other tumba no agtade and so much of acidity. No, I don't touch all that. What do I give? What do I give for acidity? I don't give an antacid. The only thing I give, please try that. Now, of course, I've gone far beyond that. The only thing I give is olive oil. 2 teaspoons of olive oil, afternoon and night, if you drink, the whole thing disappears. What do I give for a nice glossy hair? Almond oil. What do I give if you have beyond a point too much of testosterone in the scalp, the hair will lose, male pattern baldness. What do I give for that? Castor oil. Or if you have terrible dandruff and not healing, what do I give? Neem oil. Aren't these all in the nature? Nature has given everything that you require for good health. Still, we give a whole lot of things and artificial drugs, and you go on and on and on. But if as a consequence of high acidity, one bacteria comes and hooks onto the urinary tract, especially of ladies, and they get urinary infection again. And so many antibiotics they take. Frequent urinary, especially, it is not common, but female. But what is it that can flush out that bacteria? Because the bacteria has a hook. It will hook and stay there. They also want to survive, I suppose. But then what do I give? I give a fruit that flushes out. That's all that I do now. I don't give. So the pharmaceutical companies, I'm not making any business sense for them. It's okay. God will bless me in some other way. We have natural place in Mangalore to go and enjoy life. No, you don't actually have to go to Switzerland, Germany. But what do I give? It is cranberry. If any of your family are suffering from frequent urinary infection, cranberry is available in nice some dry fruit stalls in Mangalore. Take a little bit of cranberry every day. 100% the urinary infection will disappear. That's how it is. And a few things, because it's crucial. Everybody after 30, 40 now, you will get an enlarged prostate. And the other day my friend said, I said, you only remember when you can't pee, Till then you forgot me, I can't pee, please do something, because the scan showed enlarged prostate. Many have enlarged prostate. The only thing that shrinks it is raw garlic. 2 or 3 raw garlic, just crush it. 2 raw garlic, chew and eat. Within 1 or 2 days, it will start shrinking and it will disappear. What is the epidemic nowadays? It is so sad. My teachers, whom sir knows, wonderful teachers, that era of teachers is gone. They died from prostate cancer. What is it that prevents prostate cancer? Please take every day, because it now becomes so common. Prostate cancer is the skin of raw tomato containing lycopene, which if you take 100%, 100%, you will not develop prostate cancer. I, as an ENT surgeon, by 55, and yesterday morning, young fellow, 35, I can't hear, sir. And life becomes miserable. Nobody wants you. If you become deaf, that is the end of it. Because wearing a hearing aid, 60, 70,000 small, it is uncomfortable and fall has been gone. But what can protect your hearing, please know very clearly, is the skin of black grapes. What is the ingredient? Called resveratrol. If you don't take, anybody is at the risk of losing your hearing. Now, you can't take a black grape, how much? Then at least twice a week, it is now available as a tablet called Resvita. Twice a week, if you take, 100% your hearing will be normal. Especially in high intensity sound areas or diabetes and all. And concerning diabetes, if you treat or if you don't treat, diabetic complications will happen. Now, of course, I never knew. Now, because I suffered, now I have come out of sugar, 300 sugar, 3 times insulin, I come out of it. Of course, that's why you must have my wife. Every other day, she'll make sure that she checks my sugar. Yesterday, we went for a checkup with my endocrinologist. He said, you are at 5.1. Even I am at 5.6. But then I had locked my brain. Afternoon, we have a lunch. Now, even the lunch part of it I have cut off, because that is a new concept called AMAD. AMAD. What is that? A meal a day. If you take a meal a day, now please listen carefully, a cancer requires glucose to grow and live. Whereas a body can survive on ketones. So therefore, if you cut off sugar in your blood, a meal a day if you take, by about 5-6 hours, the sugar will go down. Bacteria also requires sugar. I ask students, simple question, you have very bad cold, and the mother will say, Amma, sir, he is not eating anything. What to do? He is not eating anything. I said, thank God, because bacteria requires sugar to grow. The brain has made him not to eat anything. By not eating anything, the sugar goes down, and because the sugar is going down, the bacteria will not survive. That is body's mechanism. Don't touch it. Starve of fever. Didn't you study that? You did. Did we advocate it? We will give some things to increase appetite and force the child to feed. No. Starve of fever. You starve. What do animals do when they are sick? They stop eating. 6-7 days, no sugar, they'll come out of it. Or, Allah, sir, enta idu Kannada, enta idu Seeta agi mooka bandagi breathe ratri gorke hodita untu. I suppose gorke hodita untu. So, ಏನಾದ್ರು ಡ್ರಾಪ್ಸ್ ಕೊಡಿ ಡಾಕ್ಟ್ರೆ. because Google doctors they read ಏನಾದರೂ ಒಂದು ಡ್ರಾಪ್ಸ್ ಕೊಡಿ, ಮೂಕ ಫುಲ್ ಬಂದು ಉಂಟಲ್ಲ. ಪ್ಲೀಸ್ ನೋ ದ್ಯಾಟ್ even, no, I should not criticize because doctors are fantastic people. You ask any doctor, why doctor, I asked him, final post guy, why do you get a nose block when you have a very bad cold? ಅದು ಫುಲ್ ಬ್ಲಾಕ್ ಆಗಿದೆ, ಏನಾದರೂ ಒಂದು ಓಪನ್ ಮಾಡಿಕೊಡಿ. ನೋ, ಪ್ಲೀಸ್ ನೋ, the nose generates a gas which is antiviral. The body wants to survive. So when the nose is shut down, a gas that kills bacteria, virus, fungus will be generated in the nose, and once everything is cleared, once the body is sure it is cleared, gradually the nose will open. It's a protective mechanism. One girl did not have a nose block, eventually a very bad infection happened, spread to her eyeball, and she became blind. That one eye became blind. That's one. Second, by chance you go to a hospital, this lady went to a hospital, and naturally, if you have somebody, no, courtesy does not mean that everybody is in hospital you have to go and see. Maybe you can give a phone call, but if you go to a hospital, if you come back, first thing with good soap and water, wash your hands. This lady poked her nose with her finger. Directly the infection went through the nose into the brain, meningitis. 5th day she was dead. Small 2 children. You can't even imagine the suffering and pain that father went through. So, eyes, ears, nose, mouth, throat, your head, don't touch. When you go back from work, don't touch. First wash your hands thoroughly and then only. Otherwise, it's a direct path from the nose to the brain, don't touch. So, and because that meningitis is now becoming once in a way, it is rather better. Of course, I definitely will not advise the COVID vaccine, because COVID vaccine, as a doctor I am telling, was designed to kill people. Now they are saying they have shut down the National Institute of Health because they funded the Wuhan library $20 million to what is called gain of function research. They took a normal virus and made it highly virulent, and before they released the virus, many people patented the vaccine and then they released the virus. So everybody had to take a vaccine, and the vaccine was so designed to kill. How many people are dying because of the vaccine? And at that time I said, the virus enters the body through a particular path which is closed by zinc. Are you aware? Not aware? That is my talk which I gave. Suddenly around the world it went. If you are zinc replete, at least once in a while check your zinc. If you are zinc deficient, you are making yourself vulnerable to what? Malaria. How many malaria? Sudden appendicitis will only happen when your zinc level is low. Zinc is the backbone of the immune system. Who discovered that in the world? I did. Because so many children were coming because of tonsils. Some other children are not getting. There should be something which is causing it. So we did this study. We only looked at zinc and found that all those who are getting recurrent infections, the zinc was low. So once a week at least, any zinc with iron containing tablets, please take, because you will be protected. Sudden in the middle of the night, a student will get a bursting pain. They rush to the theatre, appendicitis, appendectomy. That will not happen. Now concerning malaria, filaria, chikungunya, dengue, one bite of a mosquito is enough to kill you. What can you do? Will I advocate artificial synthetics? No. What is nature given to? As long as possible, look at nature. What is the one drop? If you put on your body, mosquitoes will not bite, and that is eucalyptus oil. Have a small bottle in your house. I had a standing instruction, my children family, if you are going out of the house, one drop. Earlier, of course, some deodorant, it need not be Odomos or anything, just a deodorant, but now the accepted is eucalyptus oil. One drop if you put, mosquitoes will not bite. But I am going to say something which I should not say. I know, I should not say. So one thing I realized, chikungunya, dengue, malaria, filaria, all are caused by mosquito bites. Are you aware? All these mosquitoes, if you catch and study, they are all girls. Boys don't bite. Yeah, what to do? That's how it is. So therefore, be very.
You have some questions.
Yeah.
Anything else we can?
No, if you give till evening also, I will continue.
I know.
But
we can call you another time.
oh, sure, sir.
Maybe there are a lot of questions.
Yeah. And so one last thing, just one point. For me, it is It is so I was it's a really fantastic how the Britishers are nasty people. 300 years they ruled, but the infrastructure they have established, especially the government Wenlock Hospital in the Lady Quotient, the infrastructure is fantastic. The government runs those hospitals. Where I used to sit, how many young mothers, Amma, sir, ಒಂದು ಸ್ವಲ್ಪ ನೋಡ್ಬೋದಾ ಅದು ಗೊತ್ತಿಲ್ಲ. Sometimes when I am drinking I have some little problem, soreness. Now don't do it because you will be frightened. The only thing I will do is I will catch the throat and I will slowly move the throat from side to side. Now please don't do it because you might get frightened. When I move it from side to side, crick, 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 a grating sensation that is called crepitus should be present. And when a young mother is saying, and it's not there, I said, I feel so sad because I know she has got throat cancer. How many young mothers, 2-3 children, young mothers get a throat cancer and die? What is the reason? What is the reason? Tea. I ask only one question. Tea will reduce iron in your diet, and when iron comes down from 14-15 to down 6-7-8, hemoglobin becomes low, you become anemic. Anemia causes throat cancer. Please know very clearly. What is it called? Post-cricoid malignancy. One country has realized that this is the reason, and Sweden has added iron to wheat flour so that nobody in Sweden has anemia. There is no iron deficiency throat cancer in Sweden. After 60-70 years of independence, do we have a national policy to avoid and prevent all that? No, we don't have. This thinking methodology has not happened. So one thing is, I run a memory clinic. It is who is the behind every successful person there is a woman. Please know very clearly, it is not the wife, the lover, the mistress. No, behind every successful person there is a woman. That is the mother. And many mothers, I run a memory clinic, many mothers come and say, doctor, enta odidru tale hogudilla, school illa, marks illa. We are so. I ask only one question: do you drink tea? Invariably the answer is yes. I have never found a non-tea drinking child do very poorly in school. No. In my house, when I saw, I banned tea. Tea will reduce iron. Iron is the backbone of memory, and if your iron is low, and they say, oh man, how many suicides are happening in coaching centers because they can't remember, and if you can't remember, you will do poorly. But did we look at iron and hemoglobin before they entered? Did we look at iron and make sure that your brain is good? What does the brain require? What is brain made of? Fat. What is muscle made of? Protein. If I want to build muscle, I need to have protein. If I want to build bones, I need calcium. But if I want to build my brain, you require fat. What fat? Ghee. In Mangalore, I know I should not talk about politics or religion or caste, but there is one group of people who take ghee twice or thrice a day. And if they are razor sharp, we call them, we give it another way. Oh, adu butter budiyappa. They are razor sharp because they take ghee almost every day. Ghee makes you razor sharp because ghee is brain food. And if you put ghee brain food on Google, you will see all that the way it contributes to neuronal health. You land up in America, how many people are suffering from neurological diseases, amyotrophic lateral sclerosis, Lou Gehrig's, Alzheimer's, so many neurological diseases. When there is a difference, you have to look at what is the difference. What is the difference between India and America? Ghee. Do they take ghee? They don't. How many cases of breast cancer? No breast cancer in Japan. Why? Because Japanese take something which we give after breast cancer surgery. After breast cancer, we give something to prevent a further recurrence. The Japanese takes it every day. What is it that they take? They take soya bean. But what does the soya bean do? It makes sure and it prevents breast cancers. But what does the soya bean do to males? It makes the mustache very thin and wiry, which is why you will not find a single Japanese like Paul's mustache. That will not happen. That will not happen because it has a feminizing effect. My friend the other day, he was going and we go for shopping, and he was taking cartons of soya milk. It's good for heart, no, it's good for health, no. Yeah, you take and you drink every day. After 3 months, I will buy you one bra because the breast will hypertrophy if you take soybean. So males don't touch soybeans, but females must take a little bit of soybean, soya sauce or soya containing wheat flour, so that 100% breast cancer will not. Breast cancer, uterine cancer, cervical cancer is caused by a virus, HPV virus. Today you must have an HPV vaccine, but before that there is something that can kill the virus. What is it that kills a virus that causes cervical cancer? It is broccoli. Do we take broccoli every day? Only when you go for a 5-star luxury lunch or dinner, there will be some broccoli in the thing. Maybe or maybe not be you may take. But please have broccoli every day, because cervical cancer will not happen, because it's caused by a virus. Breast cancer caused by, it's called the HER2 gene mutation, which can be prevented. After breast cancer, we give soybean tablet called Isovant. Didn't we have the requirement? Couldn't you take it before that happens? But before that, every female, make sure your vitamin D is 80 units, make sure your hemoglobin is 15, and make sure that your body is alkaline, and make sure you have a little bit of zinc, and that as far as possible you avoid tea, because tea absolutely will. Oh, can I take green tea? I don't have, I said, memory to 1,000 times I would have by hearted epigalactocatamine gallate, which is present in green tea, absolutely is toxic to the liver and causes liver failure. 5 people have died because of green tea. Don't touch it. You don't require, don't. No, don't touch it. It is, you will have liver failure. But I still would love to enjoy. Why is it called? I'll ask you. Why is it called coffee? Oh, I love coffee. But today we know coffee prevents later diabetes. Maturity onset diabetes prevents. But yesterday, of course, yesterday's news, the most recent, I will put it on and I will give it to sir also. What is yesterday's news? Coffee prevents diabetes, but make sure that it is sugarless. But if you take adding sugar, it has, that benefit is not there. But why is it called coffee? Because Haldin, a shepherd, found that his sheep was not falling asleep in the mid-afternoon, whereas he was falling asleep. How are they so much alert? He found that the sheep was going and grazing on a nut, and that was keeping them awake. That nut was called the kahua plant, which came from the Kaffa district in Ethiopia, from where we get coffee. But the Chinese emperor in a forest, he wants something, suddenly he likes hot water. One leaf fell and he said, "Chee!" And then he drank. That was the origin of chai. That's how it was. So there are so many things that I think. But so it is up to you. You are the captain of your health. You are the master of your destiny. You chart the path that you trod, and no one can save you from error or sin unless you take these steps to prevent within. So wish you all the very best. Of course, I am also say that I am a certified master hypnotist. So many cases, that's a different world altogether. Maybe on a different level, I can. No, people, of course, if you are studying something, I have given photographic memory. This girl who was studying, I hypnotized her, photographic memory. Next, the father came and said, "Sir, she is a university topper." What is topping? Recall. If you recall, you top the university. It's not application, it's recall. So there are a host of, there's a different world altogether, but we'll touch on that later. So it's been a nice morning. Thanks to sir for this.
Any questions? Any specific thing?
One question: how to make water alkaline?
The thing is, I do not agree with it, but there are now alkalinizing water coolers, and they say you drink from that. No, I mean, that then they are charging 1.5 to 2 lakhs or something. No, you look at on a Google, you say alkaline foods. There are so much of fruits, and I always say at least half a glass of, now you get by real company. They are good. Mixed vegetable juice is there. Or take a little one. Today, I mean, every morning I take the onions, then tomato, then cucumber, then of course red guava, strawberry plum, a little bit. All these are highly alkaline. Take a little bit of it. But the other day this professor was asking, so many cases of mouth ulcers. Mouth ulcers. What to do, man? Usually what do we do? Some become something and all, steroid. No. You must realize you get acid ulcer in the stomach. So basic logic, you also think, can it be acid causing ulcer in the mouth? So what is the litmus paper? 50 paisa, I just tested. All mouth ulcers, the saliva is acidic. So what did I do? half a glass of water, mix 2 teaspoons of alkaline liquid called citralca, just gargle and swallow. By third day it will disappear. What a magic it is. So, in any matter, as a doctor, you must have the only answer. Has it discovered by science? Then of course we did a postgraduate research work and published, put it for university. But is it part of contemporary treatment? Not. So if you have a mouth ulcer with recurrent, nothing will work. Take half a glass, citralca, gargle, swallow, third day it will disappear. Like that. Yes, please.
In one of the article we read that is a bottle called
GBS that is spreading.
What is that?
GBS.
Yeah, it is so sad. What is GBS Guillain-Barré? Oh, it is terrible. Once a person gets them, whole body gets paralyzed. But what is the thing? It is a consequence of an infection. When an infection happens, when your body is weak, only when your body's immune system is weak, you will get an infection. Then the body overreacts in an immunological fashion and causes Guillain-Barré syndrome. Now, once that happens, you have to have very powerful drug. To a large extent, the treatment is good, most will come out. But before that, I said prevent it. How to prevent it? Have a very powerful immune system. What is the immune system made of? Please know very clearly, phenylalanine, leucine, isoleucine, threonine, valine, tryptophan, these are amino acids. Amino acid capsule is available. Then how can we increase immunity? Vitamin C. What is the other thing I said? Zinc, iron, B complex. So if you take that for 10 days of a month, 10 days of a month, 100% you will not get GBS. What is the, please write it down, astamin 4 to 1 in the morning, CELIN 1 at night, Zincofer 1 at night. Take it for 10 days every month. Not only will you not get GBS, you will not get any infection.